Greetings, everyone. Thanks for joining us today. Welcome to this informational webinar for the Robert Wood Johnson Foundation Systems for Action Research Program Call for Proposals. We'll be talking about our current call for proposals and answering your questions about this opportunity. It looks like we have a good number of people joining us online, so we can go ahead and get started. This is the second informational webinar that we've done on this opportunity. So recognizing that many people with us today may already have some information about the program and its general features, we're going to try to preserve the bulk of our time today in unstructured question and answer time to make sure that we can get to as many of your questions as possible. We will give just a brief overview about the Systems for Action program and this CFP, but try to reserve the bulk of our time for Q&A today. So some brief housekeeping reminders. We are recording today's session for those who may not be able to be with us. And we will send slides and a link to this recording to everybody who's registered for this webinar today. So those materials will be coming to you, and we'll also be uploading these materials on the Systems for Action website that you can see the link on the slide in front of you today. We will keep everybody with us on mute during the webinar. Just it helps us with managing such a large group to have everybody on mute to cut down background noise. So if you do have a question, we invite you to submit your question using the Q&A box, which you should see down at the bottom center of your screen. There's a Q&A box. You can click on that, type in your question, and we'll get to those very shortly. Just to introduce a number of the leaders of the Systems for Action research program. You can see our leaders at the Robert Wood Johnson Foundation are shown up at the top of this slide. Including Carolyn Miller, Octavia Wojcik, and Jacqueline Orr. And I know that Carolyn and Jackie are with us today, and I can see them. We also have a number of our key people at the National Program Office for Systems for Action, based at the University of Colorado, shown on the bottom half of this slide as well. And many of these key stakeholders are with us on the call today as well. So actually, before I move forward, let me invite our leaders at the foundation, if Carolyn and Jackie want to say a few opening remarks before we move forward.
Thanks, Glenn. I just want to take a minute and say welcome to everybody. Thank you so much for joining us, either for the first time or for a second time, to get your more questions answered about this CFP we have out. We're very excited about this one. We think it's unique and different for the Systems for Action program, and I think Glenn will go into some of how we think that it's different this time around. And we're just very excited that there's as much interest as we've seen for this CFP, and we look forward to answering your questions and seeing the proposals. So thanks, Glenn. Also, I just wanted to say thanks to the University of Colorado team, who's just been wonderful in getting the CFP out and in holding these information and question and answer sessions for all of you who are interested in possibly replying to this call. So thanks to the Colorado team, and I will pass it back to Glenn.
Thank you, Carolyn. And I should introduce myself. I am Glen Mays. I'm part of the University of Colorado team. I serve as director of our National Program Office for this program. and work closely with Chris Lytle, our Deputy Director for the program. I know he is with us today as well, along with the other several other members of our staff you can see on this slide, who keep this great work moving. So for those of you who may be newer to Systems for Action, we are one of a number of national research programs of the Robert Wood Johnson Foundation. There are a number of for action research programs that have those words in the title. Our program, Systems for Action, as the name implies, focuses on systems and research on how to better align systems that operate across the sectors of medical care, public health, and social services. And that's the fundamental focus of our program, is in studying innovative ways of better connecting and aligning medical, social, and public health systems, delivery systems, as well as financing systems that govern those sectors, with an overarching focus on system alignment, discovering new ways of aligning systems that can advance health, and especially health equity. So that is the overarching focus. We do have a research agenda that was developed several years ago and updated more recently. You can access that research agenda on the Systems for Action website. Definitely encourage folks to take a look at that, and you get a bigger picture for the types of research questions and the focus areas of our program. So for this 2021 call for proposals was released about a month ago, and it does have a little bit of a different focus from past calls for proposals. We have issued with our program call for proposals on about an annual cycle over the last 5 years. With this 2021 call for proposals, we are focused a little more specifically on this problem of wrong pocket problems that exist across medical, social, and public health systems. And so with this call, we're interested in proposals that will study innovative ways of solving wrong pocket problems that operate, again, across systems. What is a wrong pocket problem? Well, it's basically a situation where we have an initiative that is designed to improve health and health equity, that requires collaboration across stakeholders in these different sectors of medical care, public health, and social services. But the problem is the costs and the benefits of that collaborative activity are not distributed evenly across the collaborating organizations. So some collaborators may bear more of the costs of implementing the innovation. Other collaborators and stakeholders may realize more of the benefit from that activity. And in those situations, we know from lots of past research and experience, in those situations where costs and benefits are not distributed equally across collaborating partners, what you have is just insufficient incentives to undertake the activity, and often lots of difficulty in sustaining the activity and in scaling up the activity in ways that can maximize benefits for everyone. So with this call, again, we're looking for studies that will evaluate innovative potential solutions to this wrong pocket problem, ways of more equitably distributing the cost and the benefits of collaborative activities that engage, again, stakeholders from medical, social, and public health systems. So that is the focus of this call. So we've got a little bit more of a more specific topical area of interest in this call for proposals. Again, we invite you and certainly strongly encourage you to read the full description of this opportunity that's available on the Robert Wood Johnson Foundation website, where we describe this wrong pocket problem in a little more detail. We give some examples of problems and potential solutions, but that is the overarching focus of this year's call. So a few other aspects of this program to keep in mind. Systems for Action is a research program, and so we consider proposals to fund research studies that will evaluate the impact of potential solutions to wrong pocket problems. And so first and foremost, we're looking for proposals that are proposing an innovative solution, a way of solving that wrong pocket problem in a specific circumstance that involves medical, social, and public health systems. We are interested in studies that can evaluate the impact of these solutions to wrong pocket problems, and proposals that are using rigorous research designs that can tell us something again about the causal effects of the solution that's being tested. Third, we're very focused on proposals that can evaluate solutions to wrong pocket problems using an explicit racial equity and racial justice lens. And so that's again another very important focus of proposals here. As a solution to a wrong pocket problem, we're looking for studies that can really evaluate the extent to which the solution actually solves this problem of unequal distribution of power, influence, and resources across the collaborating organizations and systems. Again, that unequal distribution of power, influence, and resources often lies at the heart of these wrong pocket problems. And so we want to see studies that test whether the solution actually solves that problem or helps to ameliorate that problem in some way by more equitably distributing those kinds of factors across the collaborating organizations and systems. Obviously, studies that are going to evaluate these kind of innovative solutions need to draw on expertise and experience from a variety of different disciplines and backgrounds. And so we're looking for proposals from research teams that have that relevant background and expertise in terms of theory, in terms of research methods, and in terms of practical expertise and experience in working with communities on these kind of solutions. So the research team composition is very, very important as well. For these kinds of solutions, we believe that strong and authentic community engagement is really essential for success in being able to meaningfully test solutions to these kinds of problems. And so we're looking for proposals that include strong community engagement methods as part of their work. And then finally, we are a 4-action research program, and we're very deliberate about the action-oriented aspect of this program's mission. And so proposals for this program should include strong and specific research translation activities that are designed to help stakeholders make use of the evidence and the scientific knowledge that's generated by the study. And so we're looking for proposals that have innovative research translation strategies that are built in as part of the proposal. Okay. Again, this slide just kind of summarizes some of the other major elements, and these elements are of Systems for Action studies have been pretty consistent throughout the history of our program. Again, first and foremost, we're looking for studies of solutions that engage delivery systems and/or financing systems that operate across all 3 of those broad sectors of medical care, social services, and public health. So engagement of all 3 of those sectors is critical. We give special preference to studies that engage all 3 of those sectors: medical care, public health, and social services. At a minimum, proposals need to involve stakeholders from the social services sector and at least one of the other sectors, medical care or public health, but we definitely give preference to studies that engage all 3 sectors. We do use broad and inclusive definitions of those sectors of medical care, social services, and public health the public health sector. You can read pages 3 and 4 of the call for proposals document to see specifically how we define those 3 sectors for the purposes of the S4A program and for S4A proposals. Again, we're a research program, so we're definitely looking for studies that can propose use of strong research designs that can help us understand the impact or the effectiveness of the solutions that are being tested, specifically impact on health and especially health equity. And then finally, as a research program that focuses on systems alignment, we're looking for proposals that examine systems level change, especially systems level change in terms of solving wrong pocket problems, solving this unequal distribution of power, influence, and resources. So studies should be looking at system level measures of change and outcomes, not just measures of change or outcomes at individual or household levels, but we want studies that can examine systems level change. Okay, so in this call, up to 4 studies will be funded. Each study will receive up to $500,000 in total funding for the project. And the projects will have up to 36 months to conduct their research and the research translation and dissemination activities. And we do anticipate that proposals supported under this solicitation will use funds primarily to support the research activities to really study the effectiveness and the impact of the system alignment strategy. Okay. This slide just summarizes some of the key resources that we encourage applicants to review and spend time with as you're developing your ideas. There is a full 10-page call for proposals document that spells out this opportunity in a fair amount of detail. So we encourage you in particular to read that full 10-page CFP document that's available from the landing page on the Robert Johnson Foundation website. There is also a document that covers frequently asked questions about the Systems for Action program, how we define systems and sectors, and what we mean by system alignment strategies, what we mean by the wrong pocket problem. And so those questions, that document should be helpful. I mentioned our research agenda, which will be helpful, provide some larger context for the kinds of studies that are funded through this program. And then you're also welcome to look at examples of previously funded studies that have been funded through Systems for Action. Those descriptions are available all on our website. But again, remember this call, this year's call is a little bit different, which is it's more specific focus on the wrong pocket problems. Okay, just another reminder that full 10-page funding opportunity document that is available from the Robert Wood Johnson Foundation landing page. Please take a look at that. The web page provides a short description of the funding opportunity, but you'll definitely want to spend time reviewing the full 10-page CFP description. Eligibility for this program follows the Robert Wood Johnson Foundation's general guidelines. Eligibility, organizations that are eligible to be primary applicants need to be public entities or nonprofit organizations that are tax exempt under the 501c3 IRS code. Applicants need to be based in the US or one of its territories. We definitely encourage multi-organizational consortia and collaborations among multiple organizations. But in those cases, one organization needs to be designated as the primary applicant for the purposes of the proposal. And so just keep that in mind, please. The application process, we're requesting applicants to submit a brief letter of intent by the end of this week, April 30th. This is not required, and it's not a binding letter of intent, but it is helpful to us in both anticipating the number of applications we're likely to receive and anticipating the general topic of your proposal, so we can make sure to assemble an external review committee that has relevant expertise. So again, not required, but we strongly encourage you to submit this brief one-page letter of intent so that we can plan for an optimal review process for your application. It just will tell us a title, brief description, and your anticipated research team. It's not binding, so you can submit this and certainly make changes, to your plan in your final proposal. But is very, very useful to us. So please keep that in mind if you could. The full proposal is due on June 9th by 3 p.m. Eastern Time. Must be submitted through the Robert Wood Johnson Foundation online application system. And those details and procedures are detailed in the CFP document. We plan to, the foundation plans to notify applicants of the funding decisions sometime in late August of this year. So this just reminds you of some of the key dates. That optional non-binding letter of intent is due by April 30th. The full proposals are due June 9th by 3 p.m. Eastern Time. Encourage folks to work on submitting their applications well in advance of that deadline. Don't wait till the last minute. Funding decisions will be announced in late August. We anticipate that these grants will start on or about October 15 of this year. Okay, so we are open for questions now. So again, to submit your question, you can click on the Q&A box down at the bottom center of your screen, and feel free to type your questions in. Welcome. I know that Chris and Carrington are from our program office are with me. We will, and Sadina as well. So we'll all try to navigate and answer these questions. So the first question is, can we use the funds to pay for the full or portion of the cost of social services for participants enrolled in the intervention? So we get a lot of questions like this, and actually have a frequently asked question response on this topic as well. That there are a couple of pretty significant limitations of planning to use funds from this award to actually pay for the services to be delivered. As this is a research program, it's primarily designed to, the funds are primarily designed to support your research activities, your study to learn about the impact of the intervention. So if you're using funds to support service delivery, obviously that's going to leave fewer resources available to support your research design and research approach. And that may place you at a disadvantage relative to other applicants who've got a stronger research approach. The other limitation that exists with again applicants that are planning to use funds from the grant to support service delivery is concerns about sustainability. What's going to happen when the grant's over? And so those are two significant issues that I think you want to think about it as an applicant that are likely to place you at a disadvantage relative to other applicants if you're proposing to use funds to support service delivery or implementation as opposed to funds to support the research design. Okay, so, and again, encourage you to look at the frequently asked questions as well for more information and thoughts about that particular question. A question: would proposals that propose to test out an approach and then subsequently research it to meet your criteria, or should this primarily be a research only endeavor? So Carrington, you want to answer this question? Or would you like me to answer it?
Glenn, go ahead and answer it. I think she's just allowing you to answer.
Oh, okay.
Yeah.
I saw Carrington would like to answer this question. Yeah, so that's another good question. I think that concern about proposing a solution that you haven't actually implemented yet. The factor that I think you'd want to consider carefully is what kind of a case can you make? How convincing can you be about the feasibility of the solution that you're proposing? If you've got ways of kind of strongly laying out in your proposal why your solution will be feasible, even though it's never been implemented, then it you may have a viable application. But certainly, our external reviewers and others involved in the program carefully consider issues of feasibility, and for brand new ideas that have never been tried out in the real world before, we often have concerns about feasibility. So if there's other related experiences that you can bring to bear to to provide a convincing description about the feasibility of your solution, then it may be viable with this under this call. If not, you may want to look at first at a way of testing your solution for feasibility, getting some initial experience with implementation, and then maybe coming back in a subsequent funding opportunity to seek funds for a rigorous study of your intervention. Okay. So question again, so it is up to, we anticipate, the foundation anticipate funding up to 4 studies through this particular call for proposals. So four studies are anticipated for funding under this particular CFP. Okay, next. A question about the wrong pocket problem. Are interventions that are cost effective but not necessarily cost saving eligible for consideration? I would say absolutely. There are lots of worthwhile programs and interventions that are considered cost effective, that have a significant impact on health and health equity, but don't necessarily pay for themselves. And those types of initiatives are certainly in scope. We don't, by calling attention to the wrong pocket problem, we're not implying that solutions to the wrong pocket problem need to be cost saving in any way. Only that solutions should find ways of more equitably distributing the costs and the benefits of that solution across the collaborating entities. Good question. Question about, is there a maximum number of communities or locales for applications? There's really not. We're open to studies of solutions that are implemented at really any scale. And if you look at the kinds of studies that we supported in the S4A program in the past, you'll see lots of different studies. Some studies that test an innovative solution in a single community. Others that may test a solution that's been implemented across several communities. Other studies that will look at statewide or even national comparative studies, looking at a variety of implementations across different types of solutions. And so so we don't really have any preconceived notions about the scale of implementation, how many communities or settings, is it a local or regional or statewide or national study? We're looking for your best ideas and assessments in terms of scale of implementation. Well, so this next question, again, focusing on the wrong pocket problem, how does one demonstrate systems level change that is innovative, replicable, and sustainable, given that many of these wrong pocket problems are products of longstanding systemic inequities in policy and program? That's an excellent question. And we understand that thinking about solutions to these kind of problems are very challenging, because you are looking for solutions to problems that are being generated through complex, long-standing, multifaceted systems and processes. So we're looking for your best ideas and innovative opportunities for testing potential solutions. I would say, encourage you to think, broadly and creatively about your opportunities to observe and study systems level change. By systems level change, we mean changes, in how medical, social, and public health systems operate, in how they make decisions, in who they serve, and so, while given the constraints of this opportunity, the funding and the timing allowed, it may not be possible to look at long-term system level change. It may not be possible to look at broad scale national system level change, but there may be opportunities for looking at again, more localized change and then more proximate signals of change in operations, in behavior of systems, in decision-making structures and processes, information systems, how resources get allocated, those kinds of aspects of system behavior. Recognize that there are real constraints on the scale of change and the timing of change that you are able to observe with over 3 years and with a limited amount of funding. So I encourage you to think creatively about those opportunities for observing systems level change. It may be more proximate systems level change. It may be change that is tested and observed on a more localized level, as opposed to higher levels of aggregation. But we're looking for your ideas on that front. Great question. Next question: how important is the racial equity and racial justice component? Would you consider wrong pocket research that does not involve race or ethnicity? Good question. Thank you for that. The racial equity and racial justice component is a core component of this particular CFP. So we are looking for studies that can test and evaluate a solution to a wrong pocket problem using an explicit racial equity, racial justice lens. If your solution is really not designed to tackle a wrong pocket problem with that kind of a perspective or lens, then that would be an indication that this particular funding opportunity is not the best suited to your idea. There may be other other opportunities that would be better suited here, but definitely the racial equity, racial justice lens in terms of evaluating the solution is a core component. You'll see, again, I encourage you to look over the 10-page CFP document again. We spell out the review criteria toward the end of that document, and that is one of the core review and selection criteria that will be used for this call. Okay, great questions. Next question: would proposals that utilize a faith-based approach meet your criteria? Certainly, faith-based organizations are active organizations and stakeholders in medical, social, and public health delivery systems. And so certainly would say that studies that are examining faith-based organizations and their role in solving wrong pocket problems involving medical, social, and public health systems, those would very much be in scope for this call. Okay, the questions keep coming. These are great. A question about the one-page letter of intent. Does it need to address the 7 components found on page 2? Not necessarily. In the letter of intent, we're just looking for a very brief description of your general idea, of your general topic for your proposal. Enough detail that will help us to understand what kind of expertise we need to have on our review committee to give your proposal full consideration. So you don't need to include, it's not a full proposal, it's just a brief one-page letter of intent. It's not binding, so anything you put into that letter of intent, we're not going to hold you to it in terms of what ultimately ends up in your final proposal. But just a brief description of the general topic so we know what kind of expertise we need to have on our review committee to give your proposal full consideration. Okay. Next question: addressing social determinants of health has been been our focus for a number of years. We're looking at housing policy as a SDOH and developing a plan that will benefit tribal communities and rural areas through the upper Midwest. Would a project with that goal meet the S4A wrong pocket grant requirements? Generally, overall, the topic you described definitely sounds in scope. You've got a health and a social determinant focus. I would just again encourage you to think carefully about your ability to engage all 3 of the sectors in your potential solution: medical, social, and public health systems. And then think carefully about the nature of the wrong pocket problem that's really, embedded in your collaborative activity. But certainly, the general topic and strategy you described, the settings and stakeholders sound very much in scope. Okay, so next question. Determining the primary applicant organization and PIs. And so this question lists a couple of different kinds of organizations: CBOs, higher education, and a health plan. The question is, when you've got a collaboration among different organizations, which should be the primary applicant organization? So, and you do see that is encouraged. We definitely encourage applications from organizations that are, that are not higher education, university academic-based organizations. So that's absolutely true. You do not need to be a university-based entity or a higher education entity to be the primary applicant. We encourage you to, again, choose an applicant who's the primary applicant, an organization that has the capabilities and the resources to manage a complex research project grant of the type that you're proposing. And again, it does not need to be an academic or university-based group. The other part of your question: who should be the PI and co-PI? Again, we leave that largely up to you in thinking about what combination of individuals are best positioned to lead the program that you're proposing. It is a research program, and so typically one of those people in those leadership roles as PI or co-PI is someone who can provide scientific oversight for the project, someone who's got the research experience and qualifications. But these are also action-based studies, and so equally important to have someone in a leadership position who can understand how the program is implemented, and how it can best engage community stakeholders inform their work. We often see PI, co-PI kind of teams that have one person who's got the scientific expertise and another person who's got the strong implementation, community stakeholder expertise. That's often a strategy that we see with these kind of proposals, because the projects really need leadership from both of those perspectives, a scientific perspective as well as a community stakeholder implementation perspective as well. So I hope that addresses that question. Very good question. Next question, if we're lucky enough to have multiple sites and partners to possibly choose from, would you rather we focus on evaluating the financing model in more sites with a lighter specific project evaluation component versus a more detailed project evaluation of each social determinant of health intervention and fewer tests of the financing model itself? Ooh, it's a good question. It's one that I don't think I can answer. I think we'd be looking to you as someone who is engaged in the idea and the opportunity to really see where the greatest value lies in terms of what kind of knowledge that you can produce through the proposal. There's definitely a trade-off there between focusing on the financing model versus focusing on other aspects of the program, or trade-offs in terms of the types of sites, multiple sites, fewer sites, larger numbers of sites. So we'd really be looking to you to think carefully and strategically about where the greatest value lies in terms of what kind of knowledge and learning you can produce. And I think either, I could see advantages to either of the approaches you're describing there. I would just encourage you to kind of to make sure you describe that the most compelling aspects of learning and knowledge generation from the opportunities that you see from your idea. Good question. Sorry, I can't give you a more specific answer on that. I think we'd be looking to you to help us find the right answer for that question. Question about how many co-PIs would be too many. It's a good question. It's another question where there's there's trade-offs there. We definitely see advantages to having a team-based leadership approach, where a PI, co-PI structure. And given the complexity of the systems that are being studied here, you may see advantage to having more than just a 2-person leadership team, maybe a 3-person leadership team. That may be important. Obviously, as you get to a larger team, there can be downsides to having teams that are too large in terms of just the overall decision-making structure and efficiencies with implementation. So I can't give you a specific answer to that, and just encourage you. I think you're thinking about the trade-offs there already. Will reiterate we often see strong advantages to a team-based approach to leadership, not just a single PI, but a PI co-PI model, and maybe that extends into a somewhat larger team. But just encourage you to be careful about the trade-offs there of getting a leadership team that's too large, and that can adversely affect just decision-making and coordination and coherence of the overall project. Wow, those were great questions. Hopefully, we were able to offer some useful responses to those questions. Again, I encourage you, we do have a frequently asked questions document on our website may have some additional insight to some of these questions and other questions that you may encounter as you move forward and develop your ideas. Encourage you to look through those as well. Again, please. Oh, and great, Sadina has posted a link in the chat feature of our webinar that gives a link directly to that FAQ page. It does have some really helpful documents. And again, please make sure to access that full 10-page document describing the CFP. We do go into quite a bit more detail about some of these larger concepts and ideas in the program, describing the sectors. We give some examples of long pocket problems, that may be helpful in thinking through your idea for this program. So with that, thank you all so much for participating in the webinar. Again, if you have other questions that come up, feel free to reach out to us through our website and our email address that's shown here, systemsforaction@ucdenver.edu. And we'll be glad to entertain those. Again, key dates, reminders of key dates. The optional letter of intent is due on April 30th at the end of this week. Full proposals are due 3 p.m. by 3 p.m. Eastern time on June 9th. Please don't wait to the last minute to submit those proposals, just in case there are technical issues that crop up. It's good to get an early start in getting your documents submitted. So thank you all so much. We look forward to receiving your ideas and proposals, and please have a great rest of your week. So long, everybody.